Good afternoon, everyone, and thanks for the invitation to be here. I'm sorry I had to arrive in my knickers, but I was pitching horseshoes all morning in western Hennepin County with the county commissioners and city council members from various cities and some of the advocates from various communities. And it was really interesting to me, relative to the speakers that have spoken so far, is that somebody who was there from deaf, blind, and hard of hearing, and talked about how you can actually make horseshoe pits much more amenable to people hard of hearing and visually impaired, which I had not thought about. So that's now going to be part of my pitch to commissioner tours. And the other is that one of the county commissioners handed me, the whole point of the pitch to the commissioners, they're pitching me ideas about what it takes to be healthy in our community and what it takes for communities to support individuals and the community as a whole to be healthy. And so I was given this fact sheet of things that they were pitching, and certainly they were pitching healthy communities, healthy youth, micro farm and mini orchard, e-cigarette, bicycle plan, and paid parental leave. I thought that was one of the things that as part of their pitch to me today. And you may wonder, why is the health department engaged in things like paid parental leave? Well, this is the definition of public health. Public health is what we, as a society, do collectively to assure the conditions in which people can be healthy. Our role is to assure the conditions in which people can be healthy. Now, most people assume that the conditions are that you have health insurance, you have good access to care, and that you make healthy choices about physical activity and nutrition and substances. And that's important, but if you really look at what creates health, the conditions that actually create health, healthcare is only about 10% of all of the determinants of health. Really important. As a physician, I really appreciate good healthcare and know it's important. But it's all the other things, particularly the social and economic circumstances in which people live. And it's the social and economic circumstances that are impacted by public policies and private policies. And the other is the healthy behaviors. Those are about 30%. But many of those healthy behaviors are actually impacted by the living conditions in which people live, work, and play. And so really it is public policies that really impact probably well over 50%. I'm thinking close to 75% of all of the things that impact our health. And the World Health Organization looks at these factors as the issues that really are necessary for people, necessary conditions for health. Certainly peace, shelter, food and water, some of the basics, but also economic security, education, stable ecosystem, sustainable resources, mobility, healthcare, and social justice and equity. And certainly one of the things, the foundations of public health, is social justice. It means everybody gets their basic needs met, and no one benefits at the expense of somebody else. And so we're looking at what are those factors that really are impacting the social conditions in which people live, work, play, and pray. And so a year ago, we did a white paper on income and health, because we were asked by the legislature to add a different lens to the conversation about minimum wage. And we talked about paid income and health. And we found that as your income increases, your longevity increases. As your income increases, your sick days decrease. And it was really important to note that the biggest impact is at the lowest end of the income scale. That the people at the lowest level, if you can move from the lowest quintile of income to the second lowest quintile of income, you can increase your life expectancy by 3.5 years. Huge benefit. So I look at the biggest public health achievement so far of the Dayton administration. Now the governor may disagree with me, but I think the biggest public health achievement of the Dayton administration has been passage of the minimum wage, because it's impacting the people who So with that lens, a group of legislators asked us, as the health department, do a similar kind of paper, a white paper on paid leave and health, because we know that there's health implications to those public policies. So they asked us to review the existing research and health implications on paid leave, both parental leave and sick leave. And so our Center for Health Equity looked at all of the research and really summarized the evidence on the associations between paid leave, both the sick and family leave, and health. And also looked at the inequities that exist currently with those policies. And so the findings were really quite dramatic, I believe, that show the fact that paid leave actually is a health concern. It is a health issue. That certainly, as was talked about, paid leave helps parents spend more time with their new babies. And we know that the bonding is really important in those first months of life. Probably the most important is we're talking about adverse childhood experiences as predictors of future problems, as risk factors for future problems. Those can really be addressed early on, prenatally, and certainly in the first 6 months of life, more impactfully than at any other time. Also with paid leave, paid family leave, increasing breastfeeding rates, both in duration, both the number of people who initiate breastfeeding and the duration of breastfeeding. And we know breastfeeding has an impact on brain development, has an impact on infections, has an impact on obesity, huge benefit with breastfeeding. And it's also paid leave, family leave, is associated with lower infant mortality. There's a whole variety of studies and they vary, but the one that is easiest for me to remember is that 10 weeks of paid maternity leave decreases infant mortality by 10%. Huge impact on a problem there where the United States has major differences with the rest of the industrialized world, with our infant mortality being quite high compared to the rest of the industrialized world. Paid parental leave, better infant health, higher vaccination rates, more well-child visits, and better maternal health, both physical health and mental health. It also contributes, paid leave contributes to healthy workers. As was noted, healthy workers are able to care for their family members. There's better school performance with paid leave. More likely to visit the health care provider for preventive services. So it really reduces health care costs and actually improves access to the preventive services, which improve health overall, and reduces emergency room visits. Paid leave also protects the economic well-being of our community. This is a public health issue. This is not just a personal health issue. So people are less likely to go to work or school while sick if they have paid leave, and I'm talking about your paid sick leave, not just paid family leave, as they recover from illness. And sick Minnesota food workers were the source of multiple infections. So this is a public health issue that we're concerned about. 208 foodborne outbreaks and over nearly 3,000 illnesses from 2004 to 2013, with about $2 million worth of costs. If people can afford to stay home, less likely to have foodborne outbreaks with the employees who are least likely to have paid leave. Employees who are sick, students who are sick who come to work really spread other diseases. So really this is a paid leave. And this just looks at some of the outbreaks, and you probably don't need to know all the details, but you can recognize that many of the foodborne outbreaks really occur from nursing homes where people don't have access to paid leave, and certainly in schools, child care, a lot of places that really have lower income individuals who don't have access to paid leave, and has a huge impact on the general public. And paid leave also, we found, also benefits employees. From the data, it shows improved recruitment, retention, and morale, lower rates of occupational injury. People who have paid sick leave actually have better occupational health and fewer injuries. And there's less presenteeism, people at work worrying about what's going on with their family and not being as productive. And it's lowering risk. Actually, people who have paid leave actually take less time off from work than people without paid leave. But one of the things that we really noted in our report, that paid leave, sick leave, and parental leave has impact on health, but also we looked at access to it. And the population that has the least access to paid sick leave is the African Americans and Hispanics, not enough in American Indians to really be able to articulate that. But it is an equity issue. People of color and American Indians have less access to paid leave. And again, as your income increases, your access to paid leave increases. As you heard, the economic burden of not being able to work, the fact that you have one income and not being able to go to work and losing that income is a huge stressor. Particularly the lower your income, the less likely you are to have paid leave. People who need it the most are less likely to have it. And similarly with education. As your education goes up, your access to paid leave goes up. That usually means that you're in a higher paid job, you're working for a larger employer. That really has an impact, disproportionate impact. In Minnesota, these are the occupations, computer engineering and science industry, fairly good access to paid sick leave. Going down to the service indicators, service occupations, less likely. The smaller your employer, the lower paying job, the less likely you are to have paid leave. And certainly, as was pointed out, there are some gaps in our laws that contribute to unequal access to paid leave. There are no federal or state laws that really require Minnesota employees to provide paid leave. The FMLA does provide it, but not all workers are eligible, and leave is often unpaid. And then lack of access to paid leave may result in utilization of other public services. It was pointed out the United States is one that doesn't have paid maternity leave. But things are happening. These are states that are actually starting to think about paid leave in a variety of aspects. On the other hand, these are states that are saying you cannot pass any ordinances at the local level for paid leave. So there's a countervailing force in this. So this is a time that's ripe for the policy discussions about the direction that we go. So in summary, paid family and sick leave improves infant and maternal health, improves the health of workers, improves use of health services, improves the health of families, has multiple benefits to employers, protects the health of the community, and it's disproportionately unavailable to people of color and American Indians, low-income populations, people with lower levels of education, and employees and small businesses. So public health is what we do as a society collectively to assure the conditions in which people can be healthy. So your advocacy, talk about the policies that assure the conditions, is part of the public health role. So you're public health workers in this. You notice that definition doesn't say anything about doctors or nurses or hospitals or clinics or even health departments. It talks about we as a society. So you're bringing forth this issue, which is a public health issue, for conversation, for public policy makers to look at, is really your role as citizens and as public health workers. Thank you.